hospital. And I thought Secretary Sangvai's summary really was spot on, because we were seeing care being provided. People need the care, but it was being provided in a way that would make the people of North Carolina very proud. That human connection, the cleanliness, the beauty of this facility. What we want to do is make sure that every person who needs this kind of behavioral health care in North Carolina can get it. We need more staff to be able to do that. And that's why we're so excited about this NC STEP Healthcare Initiative, which is bringing the first class of high school graduates as pre-apprentices. And they're actually going to leave this summer as CNA, Certified Nurse Assistants, on their way to getting a nursing program, nursing certificate. So we want to develop our workforce homegrown so that we can serve more people.
Got a couple minutes. We'll start with some on-topic questions.
Yes, sir.
What steps do you think lawmakers need to take to ensure these pre-apprentices come back to work at places like Broadway?
The main thing we have to do is make sure that our pay is competitive. And competitive does not mean the same as what they get in the private sector. It just means there cannot be this huge disparity, because folks who work here, they work here because they have a heart for service. We had in our budget funding to have a surge of resources so we could reopen facilities, units across the state. That was not included. We also had a substantial pay increase for our state nurses, nursing assistants, the med techs in our hospitals that would have enabled us to hire more people over the long term to open up more facilities. That funding was not included. So we are committed as healthcare providers to working with the General Assembly to get the funding we need, because people need healthcare so that they're healthy, and we all need healthcare for folks who are really in crisis so that we're all safer.
In your latest executive order intersects public safety and behavioral health. How does improving mental health outcomes actually make communities safer?
There are folks out there, and this is a small minority percentage of folks who are suffering with behavioral health issues, but they have paranoid delusions where they don't have the same sense of reality that the rest of us do. And we've seen flashes of terrible violence and tragedies across the state, whether it's in Charlotte or Southport or Raleigh or all over the state. And if we can intervene with people before they are at that level of disconnection from reality, we can keep people healthy, keep people safe.
We got time for two more. Sorry guys, we're super tight on time today.